Well, hello. I'm going to talk about the clinical guideline for the diagnosis and treatment of Reno ureteral colic in the emergency department. Everything from this presentation was taken from a manual published in 2019 by the IMSS, okay, talking about this precise situation. And we have to say that the stones in the urinary tract are responsible for renal colic, which is the most common symptomatic presentation of urolithiasis. Now, there are certain sections in this manual that are, for example, evidence, which is a section that talks about many studies that were taken into account in order to have many conclusions, such as that the renal colic is more common in men. The peak incidence was between 35 and 50 years. Many of them rated the pain as very intense. 95% presented, well, they had a urological history. Also, we have that 40% of the cases occurred in spring, renal function was deteriorated, some of them had relapses, and some of them presented also alternate diagnosis to the urolithiasis. We have that also there are certain signs and symptoms that are present, for example, increased serum and creatinine, hematuria, hypertension, changes in urinary flow, and even though pain is not as common, there are certain types of pain that are present. Also, we have the section of key recommendations that are recommendations that have to be highlighted. For example, in order to have the clinical diagnosis of ureteral colic, we have to have that the patient has a very intense sudden pain that in the flanks that radiates to the testicle and labia minora. And that has to be accompanied by hematuria, urinary symptoms, nausea, vomiting, and general discomfort. Also, we have as a recommendation that an initial metabolic evaluation shall be performed and has to be evaluated the urine, the electrolytes, the serum calcium, and serum creatinine. Also, we have the section of good practice points, which are many procedures that have to be taken into account and shall be selected according to the situation. For example, here we have that the radiography has to be the last method in order to discover lithiasis. Why? Because the stones are radiolucent. So, regarding clinical practice guidelines, I consider them essential for the standardization of procedures to be followed by the physician. In a condition as widespread as reno-ureteral colic in a country with such a high number of people with urinary stones, and I say this because the Mexican Social Security Institute made a survey that reported that 2.4 for each 10,000 inhabitants have this situation. Because of this, it is essential and necessary to have well-defined in all the mechanisms of action to treat it as quickly, efficiently, and as effectively as possible. Here's the bibliography.